Okay, good morning, good afternoon, good evening. This is the recording of, well, actually it's 9:15. Sorry, I saw one or two of you trying to log in, but I've had some issues with my Zoom because I wanted to uh, do the lecture from the laboratory, especially those of you who missed laboratory, so that I could show you some things in the lab. But I have some good videos that I put. Oops, whose is this? Wrong. I have some good videos on the neurologic mental status exam. So watch that video. It's here, and this is topic 8. Now next week is the beginning of your final exam, and or look at your announcements regarding if you did not go to the any of the labs, there's like a makeup paper you can do so you can have some credit for your lab. And Our lab is always open. So if you weren't able to make it in for whatever reason, give me a call. Come in, practice these skill sets because you paid for it. And I do understand issues with COVID and exposure, especially if you have high risk family members. I do understand that, but please do the paper. It's in the announcements. But you know, when this stuff kind of blows over, which just like everything in this world, it usually does, come on in and do some labs with me so you can practice certain skill sets. Okay, so what's due today? And today is the 16th. All I believe week 6 and week 7 we got backwards, but no matter what, that stuff's due. So I'll be looking at topic 7 items, topic 6 items as well, right? Because remember, I accidentally switched up 6 and 7. Another public service announcement, please get your registration done and give a call to your academic advisor today if you have not done so already. So this is the mental status exam and the neurologic exam notes, and I'm going to go over the chapter stuff because um, you can watch the video as well. Okay, and again, email your quizzes, please, so you can get a grade in. And remember, there's due dates on this stuff. Week 9 will only have a single discussion. And guess what? That mock final exam, click on it. That's not a mock. That's your real one. So click on this mock final exam. Take it, email me your answers only, and then I'll email you back your score. Alrighty? So that's enough of that. Let us now go into our textbook. And of course, it's this textbook. You. And we go to our table of contents, and we're going to look for the chapter specifically with pharmacology, calculations, nutrition, health. Which chapter is it? Infection control. I think that's why. Uh, Emergency field work. I think that's why I did these videos. I don't think there's a specific chapter. Oh, by the way, chapter 51, 52, 53, especially if you're going into nursing, please review these. These are golden, and they're from and they mirror your pharmacology stuff. Unit 6, infection control. That's not it. Yeah, I think that's why I added my own videos. There's not a specific chapter for it. So let's go through the videos together. I think that's the reason why I added that in there. So Let's look at this video for the mental status exam.
Before testing mental status, explain the examination to the patient. In the examination, include assessments of orientation, short-term memory, naming objects, following commands, mathematical calculations, word finding, concentration, spatial orientation and construction, judgment, long-term memory, and abstract reasoning.
Okay. Now, the majority of that, because a lot of the things that you can tell from your patient regarding what's going on in their head is the way they answer questions. Not necessarily the answers, you're also looking at the way they answer questions. And especially if you notice that list of everything they were talking about has a lot to do with the frontal lobe. And if you recall your anatomy and physiology, the frontal lobe is all about judgment and understanding of processes.
Comprehension and expression of written and spoken language, as well as speech, can also be assessed during the mental status examination. Well, how are you feeling?
Well, doctor, I'm having a little problem with my memory.
Okay. I'm going to ask you some questions just to see how you're thinking. Some of them will be easy, some will be hard. Don't get upset. Okay. For example, how old are you?
I'm 54.
Okay. Now, do you know where you're at today?
Certainly. I'm in Philadelphia and I'm at Einstein Medical Center.
Very good. Now, let's say you had to call a taxi to get you home from here. Can you give general directions on how you would get home from here?
Yes, I would tell the taxi driver to take Broad Street.
Okay. So you look at those three questions, and that's the orientation within three spheres. And what are the three spheres? Person, place, and time. Right? So, and that's why he also says, don't get upset, because many times the patient starts asking, why are you asking me these? I'm not an idiot. They get, especially in the emergency room, they get very frustrated because you're not asking about the broken arm or whatever. You're asking them about very, very basic things that you would ask a child. But if my patient is not oriented, they won't be able, their answers will be a little off. And that means my patient will not be oriented within three spheres.
And then take Broad Street. June.
Very good. Okay, I'm going to tell you three objects, and I want you to remember them for 5 minutes. I'll ask you again later. So you repeat them after I say them.
Okay.
A red rose.
A red rose.
A black puppy dog.
A black puppy dog.
1200 North Broad Street.
And again, testing memory as well is also, I want to assess frontal lobe.
1200 North.
Now, what would you call this?
A watch.
Okay. If the tiger was...
Now, the questions that the doctor now is asking is about, sometimes we put something in the patient's hand. And another thing that also the doctor is assessing is how they're talking. Because if you have any temporal lobe damage, there's something called aphasia. And doesn't necessarily mean you can't talk, but you won't be able to identify common things like a watch or a pen, things of that matter, or the patient will call it something else, or the patient will have a pause and have a difficult time answering.
It's killed by the lion. Which animal would be...
Lift up your right hand.
Very good. Thank you.
And that's also to confirm dyslexia, because if you have if she has any brain damage whatsoever, what she reads and sees on the paper, she might not be able to communicate. So that's and then also you're testing her vision. You're testing you're pretty much testing the integrative properties of of your patient. Another thing you're going to also look at is if you have a sample of their writing, especially for some musculoskeletal disorders or neurologic disorders, you'll start seeing drastic changes in the way they write, or it might be even illegible.
Good. Okay, fine.
Again, more
Fine,
instructions.
Ready?
Okay.
Go.
10 cities.
Right.
Okay.
Just go one to the other.
New York City, Boston.
Now, when you're asking these other, when the doctor is asking these other things, the other thing to make sure of is their educational attainment. Because if the or if any other mental, psychiatric, or psychological issues as well, your patient will have a hard time asking some of these answering some of these logic questions.
Philadelphia, Sacramento, San Francisco, red, green, haze, peaches.
Okay, there's more examples of.
Who's artist? Like a Picasso.
There's also more examples of memory and more examples of. So the mental status exam, you want to see, he goes, if there's any cause for any psychiatric or neurologic issues. Now, this is primarily the physician's job, but I added this in there because during my time as a medical assistant, how many times, you're the first person to see that patient. So noting demeanor, how they're acting, and also how they're cooperating or non-cooperating is 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 really is really important for the physician to know. And remember, we're looking at our patient as a whole, because maybe they came in for cardiac problems, but then you might see some other things as well. So that's the that's a mental status exam. And again, he goes, I want to see. It's kind of like a screening to see if there's, especially if there's a history of any head trauma or loss of consciousness. Those are the two big things that if someone had a fall, those are the big things on your interview to ask. Now let me look at the neurologic notes, see if I'm missing anything. Oh, this is your neurologic exam, and we're going to go over that in a minute. In all intents and purposes, when you do a neurologic exam, the thing that you're testing for are the patency of the cranial nerves. And the cranial nerves, and you should remember these from your anatomy and physiology too, are numbered, uh, what do you call that? They're numbered Roman numerals. So Roman numeral 1, olfactory, 2, optic. So you'll see the abbreviation capital C, capital N, and then followed by a Roman numeral. That means cranial nerve, and it will be associated with these things. And you'll see that some of the cranial nerves are fully sensory, like the olfactory and optic, and that makes sense because optic is dealing with your eye, olfactory dealing with your sense of smell. But some are combined. Like for example, your trigeminal is both sensory for your face and scalp and the front part of your face, and it's also motor for your muscles of mastication and your tensor tympani muscle goes inside your skull. So there are some that are combined, there's some are pure sensory, and there are also some like your accessory, cranial nerve 11, cranial nerve 10, that are pure motor. And these are the muscles that that we test. Um, we test for these. So we're going to watch the video in a moment, but when you look at the things that we test, you could see the tests show function. And if these functions are off, then there's something called localizing. It is a way for the neurologist specifically, right, to get to the area of the specific damage. Let's go to the neurologic exam. Oh, these are like broad neurologic exam notes. Maybe I'll add that other video. The one that was right next to the mental status exam. Here's cranial nerve. This is a neurologic exam, and well, part of the neurologic exam. Examining your cranial nerves is part of the neurologic exam, and if you look at the notes, there's other parts that we have to do. We have to look at reflexes, coordination, and coordination and sensory function is also part of this, and gait, how they walk. So when you're looking at your patient, these are the things that should catch your eye. Are they coordinated? How do they write? How do they move about your waiting room? How did they walk in, or how didn't they walk in? So let's look at. I like this video. Here's one. Here's how to do a neurologic exam. This is the Merck Manual is a good source. It's one of those for nursing and for nursing school and medical school. Merck Manuals were these really neat. It's kind of like crib notes, or kind of like cheat sheets, and it's really cool. And Merck is known to be a chemical company and also a medical education company.
Fundamentals of the neurological exam can be completed in about 4 minutes, yet still detect deficits in any of the major components. Normal findings are reassuring. Abnormal findings should trigger a more detailed exam of that component. To maximize efficiency,
Or should trigger you to go seek neurologic advice.
and demonstration by the examiner as commands are given speed the exam and minimize difficulties due to deficits in hearing, cognition, and language comprehension. Just look at my nose. How many fingers?
4.
Good. How many now?
2.
Good. Just keep looking at me for a minute.
Now he's assessing visual field when he's doing that.
Good. Now watch the light and just follow it as it moves.
Now before that, when he's just shining the light in the eyes, we want to see pupillary reaction. And then when you follow the light with your eyes and you don't move your head, you're now assessing cranial nerves 3, 4, and 6, the muscles of your eye.
Down and up. Very good. Look at me again. Show me a big smile. Good. Stick your tongue out. Very good. Shrug your shoulder.
All right. Now, sticking your tongue out assesses your glossopharyngeal nerve, and also, if there's a pathology, your tongue will deviate towards the side of the pathology. So if your patient can't stick your tongue out straight and it bends towards a certain side, then the physician and/or clinician or the neurologist will start looking at the side at which the tongue was pointing.
Great. Good. Now I'm going to whisper a number in your ear. You just tell me the number.
6.
Very good.
4.
Very good. Arms out in front. Arms to the ceiling. Close your eyes, please.
Now they're assessing coordination and balance.
Squeeze. Really good. All right. Good.
I like doing it when the patient's standing.
Be strong. Strong on the side. Good.
Now is assessing muscle tone.
Very good. Nice and relaxed for a minute.
And equality of left versus right.
Good. Take this hand and tap very fast. Good. The other one. Very fast. Good. Take that finger and touch your nose, and then touch my finger.
And again, back to proprioception and vision.
Very good. Excellent. All right. Now hold on to the stretcher. Hike your knee up to my hand. Keep it up. Strong. Good. Be strong. Good. All right. Push me away. Right. Push me away. Very good. Bring your foot up. Pop your toes up toward your hip. Don't let me push you down. Be strong. Very good. On the other side. Strong. Hold them up. Very good. All right.
Again, when you're assessing like muscle tone and muscle strength, because if everything's all good, then you're thinking that part of the brain, which is your motor cortex area 3, 2, and 1, in the middle of your parietal lobe, that means that area is good. It also means that your descending tracts, which are your motor tracts in your spinal cord, that means that is good. And of course, your muscle itself, that means that's good. Now, if there's an imbalance between right versus left, a significant one, then again, that'll also help with localizing to point to any potential nervous system lesion.
So what I'm going to want to do is I'm going to hold the foot up. I want you to put your foot off your knee and then make a straight line down your shin. Very good. Excellent. Do the same thing with it up. Right now, I have to scratch the bottom,
Okay.
but it's annoying. Sorry.
That is.
All right. There you go. Okay, very good.
Now, the thing that he was kind of doing was, it's called your Babinski planar. That assesses spinal cord integrity. In the emergency room, especially if there's loss of consciousness or the patient can't move their feet or their legs, and there's a definite spinal cord injury, you're going to see fanning of the toes, which is indication of spinal cord transection, which is not good.
I just want to see how you feel things. All right. So I have
And of course, sensory.
take that piece of cotton. Just tell me, are they about the same? Roughly
Yes,
the same. Good.
same.
About here and here, roughly the same.
Same.
Here.
I tell my patients to close their eyes when I do that.
Now this will be a little bit sharp.
Okay.
Is that sharp? Roughly
Sharp,
the same.
yes.
Good. Here.
Same.
Morning. Now, this thing that the doctor is testing now is 2-point proprioception.
Have a tuning fork.
If the patient has some sensory deficit, they won't be able to tell two little pricks of that little toothpick apart. So that's what that is. And I guess I don't have anything to say about that. The next is tuning fork stuff.
Okay.
Vibration. Buzz. And buzz. About the same.
Same.
Good. And here. And here. Roughly the same.
The same.
Good. I'm going to touch your right hand, your left hand, or both. You just tell me one.
That was weird. He
Okay.
didn't hit the tuning fork.
What I touch.
Both.
Good. Very good. You can open your eyes. I'm going to just tap you here.
Now, he's now about to test reflexes. And I'm going to show you a reminder diagram regarding reflexes. Now, reflexes have nothing to do with the brain. The three ordinate parts of your reflexes is, of course, your sensory, which is your ascending fibers, your interneuron, which will assess the spinal cord itself, and your descending fibers, which is motor. Now, we've been testing those things previously, but not all together and not to a specific level of the spinal cord. And that's what that's what the physician is now doing here regarding the reflexes. And if we were in lab, we get to do this on each other. It's kind of fun.
Relax.
Okay.
See how her hand jumped a little bit? And that's what you're supposed to see. And the patient must be totally relaxed, because if they're tensed up, it won't work. It won't work as an assessment.
Now bring your heels together like a soldier at attention. Eyes closed. Don't let me push you over. Very good. You can open your eyes. Can you just walk over about 5 feet? Good. Come on back. Good. A couple times. Bounce as if you're trying to catch a bus. Back and forth. Back and forth.
Again,
Good.
he's assessing gait.
All right.
He's assessing strength,
Walk backwards.
physicality.
Stop. Come forward. One foot right in front of the other. Straight.
And don't you notice some of these tests mirror the sobriety test that the cops give you?
So what day
You know, when they pull you over?
Today's Monday.
It's the same concept.
It is June 7th.
Very good.
And again, is assessing orientation.
2015.
Good. I'll spot you a day. That's all right. Who's our president?
Obama.
And what's going on in the news? Any topic you want.
What's going on in the news? The basketball playoffs are going on.
Okay, very good. Can you put your right point?
You'd be amazed of patients. They look and act perfectly normal. And then you ask them these questions like, who's the president of the United States? And they say stuff like, Jimmy Carter, of course. That's stupid. And you're like, whoa. but then you ask them the year, they'll give you the correct year, but they, in context of the year, it'll be wrong. And that's how you know, oh boy, that's a frontal lobe problem. And maybe the person hit their head too hard. Or another thing you're also assessing is, because if you recall my other lectures regarding drug addicts and people who abuse narcotics, especially someone who's been abusing narcotics for many, many years. They're very persuasive, they're very charismatic, and they're very good at hiding everything. But then when you go through the neurologic exam, you're going to start seeing deficits, and you're going to start seeing things, or seeing things, not only deficits, things that are enhanced. Okay.
Pointing finger on your left ear. Do that for me. Good. You can bring it down. How much is 20 multiplied by 30? I'm saying 20 times 30.
600.
Very good.
Now
So
again,
I'm
watch
saying,
out
don't
regarding
put all your
educational
eggs in one
attainment.
basket. What is the point of that?
Don't put everything. You might lose the chance to do something different.
Very good. What are these things?
They're glasses,
What part of the glasses do I actually look through?
the lenses.
Very good. Say after me. No ifs, ands, or buts.
No ifs, ands, or buts.
Okay. Apple, pear, and peach. What are they?
Fruits,
Bed, table, and chair.
furniture.
Excellent. Good. Thank you very much.
Okay.
Okay, so you can see how, like, because they're very basic things, and if you don't kind of warn the patient, especially in an emergency department setting, they get really annoyed. Heck, they get really annoyed even if I tell them. So that's what we would have been doing in lab. If you're going into an externship that has a lot of neurologic stuff, stop by, come see me, and we'll run through these things together. Now, let me show you. Let's go back again to the notes to talk about the reflex arc that I just explained earlier. Now, remember, the reflex does not test the brain; it tests this arc. So, what are the three components? You have your ascending fibers, which is, of course, your sensory, and of course your spinal cord, which is the interneuron, and then your descending, right, which is your motor. And if you recall your anatomy and physiology, the dorsal or posterior portion of the spinal cord deals with your ascending fibers for the sensory, and your ventral root or the anterior portion of your spinal cord deals with your motor neuron. So you could easily see here, any damage here or transection of the spine, you will have an interruption in the arc. Any damage to any sensory, you will have interruption of the arc. Any damage to the motor, you will have also interruption of the arc. And did you see he tested her arms, her hands, her knees, and her feet. So it went through, I can tell you right now, from a neurologic standpoint, it went from probably your cervical 5 all the way down. Doing that will test from your cervical, your fifth cervical, 3, 4, and 5, if I could recall. I can't quite remember my neurology, but all the way down to your sacral, just by doing those 4 little things. And remember, your patient has to be relaxed, because if they're tensed up, will they be able to have that little hand jerk or that knee jerk? It won't be. Okay, so that's it for this week. And again, you could start your the mock final is actually your final exam. And remember, you also have a discussion 8 as well. And look at your grades. If there's any outstanding things that are blank, remember, partial credit is better than no credit at all. All right, and that's all for this week. Relatively short lecture, but this is kind of neat because many neurologic and psychiatric issues get hidden behind typical medical issues, and it's nice to be aware of it. And it also shows that because we're in a testing class, a class full of tests, it shows also many of the tests that we do aren't just laboratory. There are things that we do inside inside that examination room that can that can help us with the diagnosis. All right. With that being said, thank you very much, ladies. And again, my apologies for today's snafu, and we started just a little bit late, but here's the recording. If you have any questions, comments, please give me a call. My number is up there, and so is my email. All right. So next week, this is, I believe this should be our last lecture. So we should be finishing everything up. And again, my offer still stands. I'm okay with one-on-one laboratories if you feel that you know, being in a group setting is not for you. Okay. All right. Thank you again. Thank you very much, and talk to you guys soon.